Good day and welcome to the Editor's Podcast. This is Dr. Linda Snetzelaar, Editor-in-Chief of the Journal of the Academy of Nutrition and Dietetics. And with me today is Dr. Marlene Schwartz, who is the guest editor for the theme issue titled Child Nutrition and Health Policy. She is a professor of human development and family sciences and director of the Rudd Center for Food Policy and Health at the University of Connecticut. So I'm delighted today to ask a few questions about this particular theme issue. And I'm starting with, why were you interested in serving as guest editor for the theme issue of child nutrition and health policy?
Well, first of all, thank you so much for having me join you today. The answer to that question really goes back to a transition that occurred in my own career. I am a clinical psychologist, and I spent the first 10 years of my career doing clinical work with individuals who were struggling with their eating and their weight. And our focus was individual therapy, helping people regulate their eating behaviors, maximizing the nutritional quality of what they ate, and really trying to improve their health. But I started to feel after a while, especially in my work with children, that we would do all this work in my office to try to focus on their behaviors. And then they would leave my office, go out into the environment, and the environment would basically undo everything that we were trying to accomplish. So, for example, there was a student I remember who was in high school, and she talked about how after school, when she had practice, she wanted to get a snack, but all that was available were vending machines that had things like potato chips and cookies. And it just really struck me that perhaps instead of trying to teach children how to navigate that environment, we should probably change the environment in the first place. And so that's when I really decided to shift my research to focus on the environment and focus on ways to change it through policy.
And why is this topic important specifically today?
So the topic is important today really because we haven't fixed the problem. The environment that we are in is still working against us in many ways in terms of making it easy for people to make healthy choices, to have access to healthy food. And so I think as a field, we need to continue to look for policy solutions to improve the environment.
I know that in your theme issue, you have listed 3 broad categories. And could you tell me why these categories were chosen and what they are?
Sure. So the first category is broadly the federal child nutrition programs. So this is one really powerful way to influence millions of children every single day in the United States. And programs such as WIC and the federal school meal programs are required to follow nutrition standards. And by strengthening those standards and expanding those programs, you can really reach a lot of children and really help them have access to healthy foods. I think of WIC as sort of the original food as medicine program. It is designed specifically for pregnant women and young children. And the studies in this issue examine things like the impact of longer participation and highlight factors that can really inform efforts to increase participation. So another part of the federal meal programs are school meals, of course, school breakfast, school lunch. And another requirement that people aren't maybe as familiar with are school wellness policies, that every district is supposed to have a written policy that talks about things like nutrition education, nutrition standards, and physical activity. And so some of the studies in this issue talk about ways of maximizing student participation in the meal programs and how important that is, having universal free school meals, what we learned from the pandemic and more recently in select states that have universal school meals. And the evidence is really accumulating on the benefits of that. And then A second category is beverage policies, specifically promoting water and limiting sugary drinks. As long as I've been in the field, this has been a public health priority. Sugary drinks are inconsistent with the dietary guidelines, and there have been really significant policy efforts to do things like remove soft drinks from schools or changing the default in children's meals at restaurants to water or 100% juice. So some of the studies look at the impact of that default beverage policy. And also, drinking water is a piece of dietary advice that really no one argues with. And a couple of the papers really dig into the process of how communities can identify strategies that will work for them in terms of promoting more water. And there's also a paper on the cost of a school-based program empirically supported called Water First. And then the third category, the final category, is food marketing in the media. And the studies in this section really capture how the messaging that children and parents are exposed to might be misleading and promoting unhealthy foods. You know, we've been studying food marketing at the Rudd Center for probably the last 15 years. And when we started, it was all about television, ad spending, and exposure to TV commercials. But those days are really behind us. Children are now seeing ads on their own devices and platforms such as YouTube. And so one of the papers is about what kids are getting exposed to on YouTube specifically. And then another paper looked at the health claims on children's fruit drinks. Companies try really hard to make these products seem healthy, but essentially, unless it's 100% juice, perhaps mixed with some water, these are sugary drinks, and parents really need to understand what kinds of added sweeteners are in them.
Thank you. Very nice detail around those categories. I'm wondering too, as we sort of break down your theme issue, what are three major points that you feel readers should take away after they read articles in the issue?
Sure. So I think one major point I would love readers to take away is that the nutrition standards in the federal meal programs matter. These programs need to continue to update their standards and be supported in implementing those because of the number of children that are affected by them. I would say a second message I would like readers to take away is to really question the food industry and the online entertainment industry when you are getting messages either from them or paid for by them. These industries have ulterior motives behind their messaging about nutrition and food, and it's really difficult to sort of police what they're saying because of the sheer number of messages and all of the different ways that now through social media they can reach young people. So that's a second takeaway I would love people to have. And then sort of the third one is simple: drink more water and don't be tricked into thinking that sugary drinks are good for you. So that would be a great third message.
Terrific. Thank you so much. Very, very helpful as we look at that issue. So my last question relates to the RDN out there who's practicing, and I'm wondering what you might say to that practicing RDN relative to this particular issue.
Sure. So I think one of the things that is really helpful, I think, for the RDNs, and certainly for me when I was working individually with people on sort of helping them with their eating, is to help teach people that they also need to be skeptical of some of the messages out there. I teach a class at UConn, and we sort of talk about nutrition education, and I asked my students where they get nutrition information, and their answer was Instagram and TikTok. And so we spent a bunch of time in class looking at those messages critically, you know, sort of examining them, talking about how to distinguish trustworthy advice from not so trustworthy advice that's basically marketing. So I would love to sort of have RDNs come away from this thinking of how to work with the individuals to help them, you know, kind of identify the messages that they should be listening to and those that they should not be listening to. One important thing is to check to see who is funding the person that you're listening to online. So a lot of the influencers that my students were paying attention to, when you really dug in, you could see that they were receiving funding from one company or another. So that's the first thing. The second thing, and this is something that I'm super passionate about, is really helping to take advantage of this federal policy we have that every district needs to have a school wellness committee that puts together school wellness policies and makes sure that they're implemented. So I would love it if more people who have the kind of training that an RDN has would join their local school wellness committee. You don't even have to have children in the school district to do that. The committees are supposed to have people from the community as part of it. And I feel like these are really underutilized, and it's a great way to have a significant effect on the policies right there in your own community, in your own school district. So things like how to increase participation in school meals, looking at what's being served in the cafeteria. I mean, the expertise that RDNs could bring to collaborating with the food service director, offering to brainstorm. These are all super important. And then finally, to use your voice as a nutrition professional to advocate for the policies that are going to make a difference. I've testified in a number of hearings, at the state level here in Connecticut. And when you come in as someone who studies this, who's been trained in this, people really do listen. And so someone with an RDN would really have a lot of sort of authority and experience to bring to those settings, and I think could really help promote policies that could help us improve the environment for children.
So important. Great ideas for RDNs. Thank you.
Sure.
And finally, I just want to thank you for your leadership on this critically important theme issue. And I think that the ideas that this issue presents, with you at the helm and making decisions on types of articles that are included, will be of great interest to our readership. And I so appreciate your willingness to devote time to this interview. Thank you again.
Absolutely. Thank you for inviting me and giving me this opportunity.